All right, good morning, everyone. I'm not sure how many folks we've got on. Looks like we've got a pretty good crowd already. Happy Monday. If you haven't already, please go ahead and use the QR code to sign in. Get your credit for attending. It's also been placed in the chat, so for those that after we remove it off the screen, it'll be in the chat, and we'll remind people again before we get off. Okay, looks like we've got 32 participants. So in terms of quorum, that will probably get us there. So I will go ahead and call the meeting to order, as we have a lot to get through on the agenda today, some of which will require your participation. So we're excited about that. Looks like the first thing we'll need to do is approve the minutes from our October meeting. Those were sent out. Hopefully everyone had a chance to review those. Are there any updates? Okay, we do have a motion to approve in the chat. Can I have a second?
Okay. I saw a second, but there's no name to it. So if you can just shout, put in the chat your name so we can capture that for the minutes, that'd be great. Thank you.
Any discussion in regards to the minutes? We do have a motion and a second. Any discussion, edits, updates? All right, then, all in favor, please say aye.
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 Aye. Aye.
Okay, any opposed? All right, the ayes have it. Very good. Thank you very much. Next is just our Georgia Trauma Commission update. So I will turn it over to Liz and Dr. Medeiros.
Thank you, Dr. Walker. Good morning, everybody. Hope everybody's staying warm. Dr. Medeiros, are you online? I wanted to just check and make sure if you want to go first. Maybe not. Okay.
See her online yet.
Okay. Okay. Just a couple of brief updates for this group. One is that you may recall that back in the summertime, Dr. Ashley presented to this group on what was our trauma system stabilization program. Essentially, our funding, while we're very fortunate now to have the trauma trust fund, where the majority of the super speeder funds go. For those of you who've been in around the system for a while, you know our trauma system in terms of trauma centers has grown almost 130% since the commission started. I think we were at like 13, 14, 15 trauma centers, and we're now up to 34. So we don't have enough money, essentially, is the bottom line. So Dr. Ashley and I spent quite a bit of time together, and he presented to you all what we came up with, which is, we really need over 100 million, somewhere around 120 million. But we created what we thought would be sort of a palatable kind of stabilization, if you will, to fund everybody at sort of that 50% readiness piece. So I'm happy to say that through the contacts Dr. Ashley has with a number of the legislators and some key folks who hold chair positions on the appropriations side of both the House and Senate, this is actually growing some legs now. Now, it doesn't necessarily mean that it will be funded for this session, but at least it's getting some airtime, and it's getting heard next Wednesday at the Senate Health and Human Services, as well as the Lieutenant Governor's office, and then Representative Matt Hatchett, who is over appropriations. So those are some really key things that we're really excited about. It's already the governor's policy folks have already heard this, and as I mentioned, it's making its way around. So we're getting a lot of press time around this. Several folks have already reached out to ask me if there would be talking points, and thank you for that. And yes, there are talking points being crafted right now, so that for those of you, you know, who have your external affairs or government affairs folks up there in and around the Capitol, I will send that out to you. We do plan, Dr. Walker, your government affairs person, Julie Wyndham, who's been a great source of, you know, sort of advisor to us. She agreed to potentially pull together a small group of folks that are some of the bigger centers, government affairs folks, some of the bigger system, you know, Wellstar, Piedmont, yourself, and kind of talk about this, because I know folks from those bigger systems, you know, really have a strong presence up there at the Capitol. So I think that would really help for that group to kind of understand and have the talking points down and be able to address some of these things as they come up. So, so that should be done by today. And so it'll be a busy day for us on Wednesday, and then hopefully later in the session, we'll either be heard at the House now has a little bit different structure for the last 2 years. It's a public health committee, or I believe it's health. The former health committee, as we know it, has been split off into 2 separate committees. So hopefully we will get on one of those or the other committee agendas, and we'll be able to present on the House side as well. So I will certainly keep you all updated, and happy to take any questions on any of that. That's kind of the major update, I think, Dr. Walker, unless Dr. Medeiros joined and has anything else to add.
Sorry, trying to get off mute. Nope, I think you covered it pretty good. It is a very exciting time for us, for sure.
All right, excellent. Thank you for that. Liz, were you going to also during this part talk about the approved 2024 what do you call them?
Oh, the performance-based pay. Yeah.
Yes.
Yes. Thank you. Thank you. Yeah. So if you all remember on your last meeting, I know some of these things kind of run together, and when you're not looking at it every day, we're always here to reach out for help, please. You know, by all means, let us know. But you're kind of mid-year in your contract, and we have to do all these things really far in advance. So at your last meeting, we got your approval for the performance-based pay metrics for next contracts. We put that out early because typically the meeting attendance piece starts January 1. So I want this group to all be aware of what this is one of the 75% meeting attendance required. And then we need, you know, we want your requirement to come in person at the spring meeting, which is in May, which will be that we'll have much more to come on that a little bit further down on the agenda, where we're going to do the second trauma center finance webinar. So we just want to make sure that you understand what all your attendance requirements are. We know that all of you at this executive level are very busy, and we want to make it worth your time, number one, and number two, if you do have a conflict, you can send a designee to these calls. We just need that designee to know that they QR code in, so we know which center they are covering. So that PBP was approved and was approved by the full commission in November. So so all that goes into effect, and that you'll see that coming in your contracts for the next fiscal year. Not any major substantive changes to that, essentially. It's still all the same meeting requirements. One of the things that I also want to mention, Dr. Walker, with respect to that, not necessarily a meeting attendance, but one of the things that the commission is spending some extra funding on is, as you all are probably aware, the American College of Surgeons Gray Book, or 2022 standards, finally went into effect just this past fall. So anybody who's having an ACS verification or consultation visit, now you'll be on the new standards, and the new standards require that you have one certified coder on your registry team. So whether you have one registrar, if you're a level 3, you have to have a certified coder. So we're actually paying for that coding course. The coding course doesn't mean that your registrar gets certified. It just means that they've had the course content that they need to have to successfully sit for and pass that course. So that's just one part of it, but that course is $750 a person. So to take that financial burden off you, we're paying for that. We just talked about this Friday on the level 3, level 4 call. And so we'll be sending out to your teams, your trauma program managers and teams, the registration link and all the information about that. So that is forthcoming, but I wanted this group to know, because I know it's hard to get folks away from your program, but this is really a good opportunity to have your registrar in the room with the expert coders, learn from the instructors, learn from each other. And it's going to be 2 days. And I see Tiffany just put, do we have a meeting location? Yes, we're doing it at the Georgia Public Safety Training Center, so that it will be right smack dab in the middle of the state. Okay. And yes, the May meeting is at Chateau Alano. That was Gabby that typed it in there. Thank you, Gabby, for keeping us straight. So that's it for now. Unless there's any, you're welcome, Tiffany, unless there's any other question. Try to make this doable. I know for some of you that may still mean an overnight stay for your registrar, but I think covering the $750 for the, for the course is going to be the bigger part of that fee. We're going to provide lunch and all that. They'll just have to, have something for breakfast, or if they have to stay overnight, that will be another fee associated with it, but still the bulk of that course. Then later on in the year, we plan to do an update course, which won't be the full course that they need to take the exam. So that'll be an update on the newer coding that will be required for 2025 admission. So that's up. So we're doing everything we can to make sure we keep your folks, these courses, we know they're costly, so we want to make sure we're supporting that. So if you don't have, you probably need to go back and ask your trauma program manager, do we have a certified coder on our team? If not, you're going to need to make sure you send somebody to that course.
Liz, if I may make a comment too, is this first course going to be the 2008 course?
Yes.
And that's what the certification is based on, is the 2008. So you can almost consider it a review course of sorts. So even if you've got registrars that have taken it and it's been several years, it's a great thing to go back and reinforce some skills. But we really want to emphasize attendance by level 3 and 4 centers, because several of those centers have people, coding who have never been to an AIS. And so even in those centers also, we want to emphasize registrars first, but we also, don't we have unlimited seating capabilities or pretty high seating capabilities? Do you know, Liz?
Well, I think just cost wise, because this is gonna be like a $40,000 investment. I think we
Right.
were limiting 60, we were limiting it to 60. We bumped it up, so it's 60 people. So whether or not if you just
For
have
both
someone who
courses?
never, yeah.
Okay.
No,
And
I'm
just
sorry,
remind you,
the AIS is cheaper, Tracy, that's a virtual course. The update
Yes.
course does not have to be done in person, so they
And
can
just
do that
be-
on demand at their own pace.
yes, and so be thinking about AIS for your PI people in your facilities and the trauma program manager. Because that's very important in some of the things that you do, and we've gone over those standards in the gray book, where, you know, how can you oversee things in your registrars if you don't know what they're supposed to be doing? I've taken it twice, and I found it very interesting. Nurses tend to overcode, and so they slap my hands if I try to code now in the registry. But fortunately, I understand the reasoning, and I appreciate the fact that we have people who go by the book and they understand the rules. So it's very important that you get people into the course, if at all possible. Thank you to the commission for funding this.
All right, yes, I would echo that. I think definitely this is a benefit for all of us, for all of the trauma centers, a benefit of us, you know, being a part of this, of the trauma commission. So we do appreciate that. Okay, we have more ground to cover, so let's move along down to the new business. The next thing is the Trauma Center annual actual user report.
Okay, you should be seeing that on your screen right now. So for many of you, you don't actually submit your invoices or your deliverables for your contracts. This is changing a little bit around the way you report out what you actually use your funds for. So this is just kind of a cover page to it. We'll get into the sort of meat of how this is going to change. Right now, this is, you can go to the next page, Gabby. Right now, this is just a small little line in your invoice, and you just kind of check a few things and, you know, what you spent most of your funding on. Now we've sort of divided it up into several different categories, and we want you to sort of give us what you've actually put towards in terms of fund, what amount of funding you have put towards each of those initiatives. So here, just to give you some examples, this is trauma-related training. That could be CME, it could be certification classes, conferences, and you can even include your training equipment. We know you have to, you know, if you're doing your own, let's say you're doing your own trauma nurse course for orientation, we know that you have to replace those things every once in a while. The second is big category is anything performance improvement or anything related to data collection. And this could be anything from consulting fees, your web hosted registry, any other components of the registry. And we know those costs are skyrocketing, so it's important to capture those. We know from our readiness cost surveys that injury prevention, community outreach, and education are probably some of the costs that are some of the things that folks don't report a lot of costs in. So if you're using some of your funding for that, you know, we want to know if you're putting, you know, what does that look like? Is it community education programs, you know, anything around your trauma center or trauma system awareness, outreach programs, support for trauma-related research? Obviously, that's going to be more of the level 1 centers. Is there a next page on there too? Yes, thank you. Okay. And then any trauma patient-specific care equipment. If you're replacing your CT scanner, something huge that you're using your readiness funds for. We know some of you do use your readiness funds for major capital improvements. Any other physical structure changes to your building. Anything that you use to support your infrastructure, like paying a stipend for your medical director, a portion of the funding going to your trauma program manager, or a use justification for an additional trauma registrar. And then the next section is where I think a lot of you do report your monies go to. And some of you, if you're using a lot of your money for this, you probably don't have a lot of money left over. But what we want to do is kind of limit, because if you are dumping the money into this, you really don't have anything else to spend for the rest of the infrastructure for your program. So this would be your trauma surgeon call stipends, or any other subspecialties, or any mid-level pay or contract or stipends. And then we did include an other category so that you're covered if it's not listed here, but you're spending your funding on that. We just trying to, you know, the legislators love to hear, you know, about the accountability piece related to funding. Dr. Ashley always talks about how we're not a bank, and, you know, there's PVP tied to your funding, as well as we collect data about what the funding's being used for. So this is just another tool to help us do that. So happy to take any questions on that.
So Liz, does this cover like calendar year or fiscal year? And
It's
then
the
when is
same.
it due?
It's the same as what you're currently doing. It's just a new report out for it. It covers the fiscal year.
And only applies to readiness cost.
Correct,
It's a
correct.
little
And this
more
will,
formal or in a format.
correct. And this will
Okay.
be part of your FY25 contract.
Okay. So currently we don't have it, but when the 25s come out, that all this will be in there, or will this be due before the 25 contract?
It will be in your 25, so it's not due for this year.
Okay.
Okay, and I think someone put a similar question in the chat. Did that answer your question? They asked, when are these sent out to the centers and when are they due? So I think you answered the when are they due part in a when it will be sent out. That was Brandy Fitzgerald who's asking this question. When will this be sent to the centers?
So you'll get this around June 1st is when the FY25 contracts go out. So this will just replace that sort of 3-liner or 4-liner that's on there right now. And so we'll have much more discussion over it. I just wanted you all to kind of see and prepare for the changes that are coming.
Thank you. Any other questions? Okay, moving along, the next order of business. So during the last meeting, we presented the meeting schedule for this year. And because the meeting, the GQIP spring meeting is occurring a little bit later in the year than it historically has taken place, there was discussion last month around whether or not we could move the meeting that would normally be our, what was it, July meeting, June or July meeting, if we could move it back to August, because we will have just met in May, so people wanted a little bit more time in between those meetings. So what we have done is we have put together just a very brief survey. If you will use the Mentimeter code here, you can vote on an August date. There are two suggested dates that you can vote on for us to move that meeting to, and then we will just take the majority vote on that.
Okay, so yeah, this is where Dr. Walker will need everybody to get your phones out. So we need a little audience participation here. We did this by Mentimeter because we have a couple more things coming on the agenda that we're gonna cover, to get your feedback on, and it's easier than sending out like a SurveyMonkey link and trying to get email feedback. This is just much easier to do this on our meeting. So we'll give everybody, it looks like we've got 11 people so far. There's a lot of people on the call, so please grab your phone and scan in so we can go through some of this. We'll include the date for the meeting, as well as we have some questions to ask the group about the upcoming TCAA finance workshop that we're gonna do at the May meeting. And, you know, if you recall, we did one back in February of 2021. Hard to believe it's been 3 years already, but we want to get your feedback on, you know, do we need some topics that are covered again? Or, you know, are there new topics that you want to get into? So that's why we need everybody kind of to get on the Mentimeter so we can.
Hey Liz, this is Raina. I can't see anything when I pull up Minty, either on the desktop or on the QR code. I don't know. If it's a
Same.
firewall here or, okay.
Yeah, this is Becky Weather. Same here. I've tried it both ways. It's just
Just
blank.
says
It says
instructions.
instructions.
Yeah.
Yeah, it'll be instructions until we progress the presentation.
Until we're just counting the hearts of people, showing that once we we're showing 22 people. So once we take the code down, you can't get back on. So.
So there's nothing for them to vote on just yet, because I actually was confused myself, so.
Yep. Yeah.
So nothing to vote on yet. This is just making sure everyone can access the Mentimeter
Mhm.
application.
You should just see a little heart.
Okay,
it.
that's all we see. All right, thank you for that.
Right, very good. I think so. Let's try it. So this is for our July meeting. So since we're meeting at the end of May, July was a little too early to get the group back together. So we gave a couple options there for folks.
They're both Mondays, so.
We're starting off with the easy question of meeting date, then we'll get into, it gets harder. Well, we're almost split. Maybe we need to have 2 dates, Dr. Walker. Okay, looks like that second Monday date, the 19th, is working out. Oh, we okay to move on? And remember, for folks who you maybe don't want that Monday or not available that Monday, you can send a designee on this call for you. Just want to make sure that, you know, we have your representative there.
All right, so like they said, the next questions are are allowing us to get some feedback in regards to some of the information that can potentially be shared at the meeting by the TCAA finance people. For those of you that attended the session in 2022, this will sort of be a part 2 to that session, but we wanted to see what would be, you know, the best topics to cover. So once again, you see your options there. We'd love to get that feedback from everyone.
And we're doing a 0 to 10. So if you select a 0, then you don't want it covered again. So we don't want to be duplicative. and a 10 is 100% worth a repeat, or you struggle on this topic, and it almost looks like everything, folks want, and the great thing about Mentimeter is we can send out, the results of this poll after everybody, looks like that top one is covered.
Oh, I have it covered because if not, then the instructions
Oh,
go away.
okay.
Should be.
So definitely looks like we've got clear leaders in terms of establishing charges / fees for trauma response activation and improving reimbursement. Claims examples are, I feel like we need a what do you call it, person, like the person that does the horse racing.
Yeah.
Claims is coming up.
Got 28.
Announcer, commentator.
I think the one thing that she didn't touch on last time was the claims denial. She had a claims example just in terms of what folks selected for the base activation fee plus minus the ED visit fee and plus minus the critical care fee. So it might be interesting to see a claims example.
And Liz, this is Regina. I think, it'd be good for people to put some comments in the comment section if this is true, just determining if you have denials, you know, understanding, putting your charges in and are you getting paid for them or not, and if not, why not, is very, very helpful in helping to determine the best way to do charge capture and improve your reimbursement for trauma care. Maybe she could talk a little bit more about developing your finance performance improvement team.
Yeah, and we have the next, we can probably go to the next one. That's what we want folks to say. So this is
So this
just
one is free. Yeah, this one is
yeah,
free
free.
text. So if something wasn't captured in the last slide, or if you wanted to add some specific things, this is your opportunity to add that specific comments.
Lots of finance team development. This is interesting, and I wonder if somebody mentioned there about activation charges and recorded session for our finance team to review. Wonder if there would be any interest, and you can use the regular chat feature for this, but if there would be any interest in having a activation charges, you know, recorded piece, maybe if possible before the May. And then you listen to that before, and then they can just kind of record that. That would be just a Georgia, maybe just a Georgia specific version or something for our folks and for your finance teams. That might be really helpful.
Got several comments about recording. Mhm. Okay, looks like we've captured some themes here. And I think some of these themes may be, so one part of the meeting would be this kind of trauma finance workshop, but I'm seeing some other things that aren't necessarily specific to trauma finance, but still other things that we can incorporate sort of in our administrators, meeting. Because correct me if I'm wrong, Liz, this trauma finance workshop will be open to the all attendees. It won't necessarily be just for the administrators, or will
I
it?
think we had determined that we were gonna have it be cause the trauma program managers and other trauma folks are in another meeting during
Right.
this time. So yeah, this is really
It will
for
just
your,
be for administrators.
your-
Okay.
yeah. I think if you, were you kind of asking if maybe if they had like a finance team member or somebody from their finance or somebody from their program?
No,
to
what I
come.
was getting at, for instance, I see one comment about the state of Georgia plan to drive attracting physicians for trauma programs, which I think is a great grounds for discussion. I'm not necessarily sure it would be part of this TCAA, workshop, but I think that's certainly something that as administrators, we're all very, interested in, and is a worthy topic. So is there going to be another opportunity to talk about those things outside of this finance workshop?
Yeah, I think, I think that's fair. It's a little bit outside the scope of this, but yeah, we can address that through the other meetings. Well, this is great. This will all be captured and we can, relate this and send this on to TCAA. This is what they've been wanting. So this would take us probably 6 weeks to get this together via a Survey Monkey. So this is really helpful. And, as always, you can email myself or Gabby and we're happy to have your feedback.
All right, I think the next topic involves the Trauma Center Patient Safety Organization current partnerships. We've got a definition on the screen about what is a patient safety organization. Some of you are probably already familiar with that. I know that at Atrium Health Navicine, we are a part of an Atrium Health regional patient safety organization. And so I think this topic sort of gets at that specific question. We want to know how many of us are involved in our own, PSOs, in addition to the trauma PSO. So I'll let Liz give more information about that.
Yeah, I think what we're looking for here is, and for those of you, again, I know we're close to it, so I know this, and some of you have heard little bits and pieces about it, but GQIP, which is our Georgia Quality Improvement Program, which encompasses not only the Georgia TQIP Collaborative, but very exciting is that we're moving into the next phase. Gina has gone live with Arbormetrics, and there's a tiered rollout. So some of you are already able to log in and see that Arbormetrics platform, and that's going to ultimately be our statewide risk-adjusted platform. So many of you know that TQIP is not as contemporary in terms of its feedback as we need it to be. It can go, it's about 18 months behind. They've been trying to get it a little bit more contemporary, but it's a little challenging with all the centers across the country that are involved. So hopefully with Arbormetrics, and we're starting it off, sort of slow, and then it will build up over time. But being part of a PSO gives you, and not only, many of you probably already know this on this call being at your level, but Georgia has a pretty robust peer protection statute in place, but this provides an additional federal level of peer protection. And you may have heard from your medical director or your trauma program manager that we were able to have our first closed session back in August, where we reviewed 4 cases, and our fearless leader, Dr. Ashley, was the first to jump off the ledge and bring a case forward for review. So I think it was great. We learned so much. There were such great collegial conversations, but you know, I think this will enable us to take it to the next level. So what we're doing is putting in an application, and I'll let Gina speak to this if she's on the call, but we're putting in an application so that we can become a federally recognized patient safety organization. And again, that's what gives us that additional federal protection from discussing cases in a closed session such as that. So Gina, if you're on, do you have anything else you want to add?
I am on the call. Yes. This is really exciting to be able to take us to the next level of a PSO and will protect our data, that patient safety work product, as they call it, that we feed to Arbor-Metrics. And, you know, as Liz said, just another layer of protection, on the federal level, from that standpoint. So, you know, anything we can do around that work, and add that layer is just really great. And I'm excited about the ability, for us to do this. And it, you know, I think it just insulates us, as a performance improvement group. So, you know, we are hopefully submitting the application. And the interesting thing about this is you submit the application and you've really got 2 years to build the infrastructure around it, you know, once you submit it. So you don't have to do all the work on the front end. You actually submit the application, and once you get approved as a patient safety organization, you already incur those protections while you build your infrastructure, your policies and procedures around it. So I think that's really great.
And Gina, you might want to walk us through the next slide with the
Sure.
question, since this is kind of your wheelhouse.
Yeah. So, you know, I know, there are some PSOs that your organization may already participate with. And that's really what we were looking for, is does your organization already work with a PSO? And there are several, you know, in the state. We know that Atrium has one. HCA facilities, they also have one. There's also one that's tied to the Children's Hospital Association. Press Ganey also is one. Vizient has one. So there are some names out there when you look on the AHRQ website related to PSOs. So we really just wanted to know, you know, does your organization, are you aware that they work with a PSO? And you may not know, you know, that may be something that you have to follow up with your quality department for that. So we were just looking, you know, to see if you knew that your facility already works with a PSO organization or has its own. This is nice. A lot of folks are familiar with that.
Hey, Gina, it's Becky Weither. Good morning. How are
Good
you?
morning. Good. How are you?
Good. Quick question. I mean, I think this is so meaningful and such a positive movement in patient safety. Is there a process that you can share about how the decision is made, which cases will be reviewed based on the Arbor-Metrics, or is there some key areas that you're starting out with to identify, you know, hot topics or high risky things? And if you've shared that and I missed it, I apologize.
No.
Where to go find that?
That's really a great question. And like, I'm learning with this as well, as we work through it. So, you know, the patient safety work product is kind of a broad term, you know, and right now we're looking at our patient safety work product as right now as the registry data. Okay, that comes to the GQuip central site and we feed to Arbor-Metrics. So anything around that data, and then, you know, as we build our policies, that will be when we decide what goes in that bucket, you know, because we want to make it as broad as possible. So those things are protected. So it's a great question, but I don't know exactly everything that's going to go in that bucket right now. So, you know, when we had, as Liz mentioned, we had our first closed session and case, we did those case studies, you know, those case reviews were just brought by the particular facilities. We didn't pull anything out yet. The Arbor-Metrics platform was not live. Yeah, so we didn't have anything to pull out. Those facilities actually brought cases that they wanted to present. So this is a continual work in progress, and I think we'll continue to morph, you know, of how we actually find cases that need to be reviewed. So I think there'll be more to come on that. So, but we want to cast a wide net of what's going to be protected. Because I think that's going to be the best case scenario for everyone. Does that
Thank
help?
you. Yes, ma'am. Thank you for that.
Okay.
Thanks.
And I think too, Gina, if you remember from the call on Friday, Becky, this doesn't necessarily pertain to you as a level 2, but on our level 3, level 4 call, a couple of the level 3s brought up that where they're at programs where there's only 2 surgeons, and so the trauma surgeon obviously reviews their colleagues' cases, but who reviews the trauma surgeon's case? I mean, it could be the partner, but maybe the partner is not as familiar with performance improvement techniques, et cetera. So what was suggested to me is that there is a, you know, potential that there could be kind of an external review. Now that could be a little bit expensive for some of you on the call who are at level 3 centers, but just know we're looking into that because, you know, again, now we're building this infrastructure of having a robust review. And if you're at a center where there's only a couple surgeons, it makes it really difficult to do that. So, so we're kind of looking into what, you know, is there a way to leverage a group consortium, if you will, for some of those smaller centers with, you know, smaller group members of the group practice that where you could have some kind of external review. So more to come on that, but I think you've got most responding here. And I would say we already have the answer potentially to the next question, maybe the next write-in. Maybe if you could write in, if you answered yes, if you could put your organization's name and maybe whether it's your own organizational PSO or the PSO that you're involved in. I think what Gina and I really need help working with the PSO attorney is that if you're working with a PSO, you've got on either at the system level or at your hospital level, you've got agreements, you've got, as Becky mentioned, there's probably some sort of, you know, triage or tiered or some way to review cases. And we would love to know that we could reach out to your center and try to see if we can, you know, make sure that everything that we're doing is consistent. And Gina, please add, because you're working directly with Janice on that.
Right. So that's one of the things that, you know, we apply and then you build this infrastructure and there's an entire list of like policies that and procedures that you have to build. They give you a nice list around certain things, you know, and we're all about like, you know, not reinventing the wheel, or also looking at things that are familiar to the centers, you know. So if we can take centers that are already working with PSOs and maybe, you know, if they're willing to share Data use agreements are one of those things that, we'll have to have. So, that was one of the things we wanted to ask this group, if you already work with a PSO, we may be able to reach out to those centers and say, hey, would you be willing to share some of those documents as we work through this process?
Okay.
Looks
And
good.
again, for those of you that perhaps are unsure or don't know, you can certainly, send us an email offline once you find out, and we'll make sure that information gets included in the responses. All right, I think the final thing is I wanted to just very briefly mention the TQIP conference. So I did get the opportunity to attend the TQIP conference back in December, and they had an administrator's track, which I thought was really a brilliant idea, and I was able to take advantage of that opportunity. It just so happened that it was on a Friday. They had put all the administrative related meetings or relevant meetings all together in one day. It was on a Friday, and I was able to coordinate and attend. And really, I can't tell you how much I highly recommend. If you have the opportunity to attend the TQIP conference, it was, of course, my first time attending, and I'm a chief medical officer, so quality is what I do for a large portion of my role. So from that standpoint, it was very relevant for me to attend and really see how the trauma service line, how much quality is just a part of their day-to-day work. And it was really rewarding to see that. I also took a ton of notes, and I got ideas. It's a national conference, so of course, you meet and see people from all over the United States, and it's all levels as well. So it's not just the large centers that are there. It's so you just get this great variety of people that are doing some fantastic work in their organizations, and see what other states also are doing. I mean, I will say that Georgia is a leader in the trauma space, but still we can learn, and there are plenty of other states that also have robust, statewide trauma programs as well. So I know that last year it was in Kentucky, so it wasn't a bad travel trip to have a kind of a one-day turnaround. This year it's going to be in Denver, Colorado in November, the 12th through the 14th. I think it's going to be more so in the middle of the week this time. I think it's a Tuesday, Wednesday, Thursday, but it's early enough that I hope some of you will consider attending and finding that time on your calendar. I assume they're going to have another administrator's track this year. I certainly wrote my feedback. I sent it in and told them that I enjoyed it, and I hope that's something they would continue to do in the future. So I assume they're going to have something similar. I don't know exactly for sure, but I just wanted to let you all know that if you have the opportunity to attend, I would highly recommend it. And I think it would be a worthwhile thing for you to attend. Okay, so in terms of a summary, it looks like we got lots of feedback today on that August committee date. I think probably the 19th was the date that went out. We showed you the Trauma Center annual actual use report. That's for your FY25 contract. We talked about the TCAA finance work group, so we'll take that feedback back to them so they can curate a presentation that will hopefully meet all of our needs. And then we had a great discussion around the Trauma Center PSO partnership. So I really appreciate everyone's time and attention this morning. Any final questions or comments from Liz or anyone else on the call?
I think we're good
Um,
here.
If you have not, the chat, there's the link in the chat so that you can record your attendance. Please don't forget about that. We want to make sure you get your credit for attending. And then the next time we meet will be in May in person at Chateau Alon. So I look forward to seeing everyone or your designee there in May.
Thanks, Dr. Walker.
You're very welcome. I will call the meeting adjourned at this point. Everybody have a great day.